typical stroke that we think of is called non-hemorrhagic or ischemic stroke. And that's when a clot blocks a blood vessel in the brain. And it can be coming from multiple areas. One of the most common things is people have heart problems. They have atrial fibrillation, where their heart is fibrillating. And when it's doing that, it can form clot in the heart. And then it breaks off and shoots up, and the next place where it lands is in the brain. If you have carotid disease blockages, you can form clot. Those go upstream. So basically, an ischemic stroke is clot that's in the blood vessel in the brain. The hemorrhagic one is basically from aneurysms, where they rupture and bleed. And there's also an entity called arteriovenous malformations, where there's an abnormal tangle of blood vessels in the brain, and they get weak and they can bleed too. So those are the hemorrhagic strokes. But typically we think of the ischemic stroke when the patient comes into the emergency room. When they say stroke, it's an ischemic one where there's clot somewhere in the blood vessel in the brain.